Hello everyone, my name's Rob and I'm one of the doctors that works with the urology team. I'd imagine that you're here because you've been asked to take part in the COSTAR trial and you want to know a little bit more about it. Well, the good news is that you're in the right place, but before we go on to talk about the study itself, I wanted to talk a little bit more about trials and why they're so important to us. Trials are important to improve patient care. They allow us to compare what's currently done versus something that's new, and then they allow us to statistically compare them and work out what is best for patients. Putting it simply, without trials, all treatment would stay as standard treatment, and we wouldn't have any development for new treatments or new ideas. Ultimately, we need these new ideas to be able to provide better care for our patients in the future. So, in the case of COSTAR, it really is in the name. We are comparing UroLift and standard TURP or transurethral resection of the prostate ahead of radiotherapy. Now you understand the name, let's talk about the trial itself. COSTAR is comparing two treatments that are available for an enlarged prostate before you have treatment with radiotherapy for prostate cancer. Both of these treatments aim to make going for a wee a lot easier. If you didn't have these treatments before you had radiotherapy, there is a danger that the radiotherapy can irritate the prostate itself and make going for a wee incredibly difficult or impossible, and this is an emergency. So I think we can all agree that some form of treatment is needed. But what exactly is being offered in the COSTAR trial and what are the differences between them? For this, we definitely need some pictures. Here is a very, very simple picture of your urinary tract. You've got your kidneys. These go down to your bladder. At the base of your bladder sits your prostate, and through that is your water pipe. To explain TURP and UroLift in a little bit more detail, let's zoom in on your prostate. And this is the tube, or your water pipe going through. Let's talk about TURP first, which is the standard operation. This involves cutting a channel through the prostate to improve the flow of wee, like so. For this, you need to have an anaesthetic, and the operation takes about an hour. You also need a 1 to 2 night stay in hospital and a catheter for after the operation. To explain UroLift, let's get rid of these lines. For UroLift, in this procedure, instead of cutting, clips are inserted into the water pipe through the back of the prostate. What this does is widen the wee channel to improve the flow. This only takes about 15 minutes and can be done with a short or local anaesthetic. It's worthwhile saying here that UroLift has been used for many years in treatment for non-cancer prostate treatment, but it's never been directly compared for patients who do have prostate cancer. Ultimately, at this stage, we don't know which treatment is better. So if you do say yes to the trial, then you'll be randomly assigned to either have a TURP or UroLift. Regardless of which procedure you receive, we'll be incredibly interested to know in what your symptoms were like before your procedure, and crucially what your symptoms are like after your procedure and treatment. We'll ask you about this with interviews, and this can be based on your preference. They can be face-to-face, they can be video or telephone consultations. So I hope that makes a little bit more sense, and you've got a slightly better understanding of what the COSTAR trial is and what we're trying to do. For more information, please do have a look at our website. And many, many thanks to NIHR for funding this project, as well as our contributing hospitals.